So anyway, all of this, though, is about building systems, and I can give you lots of other examples. If you move to a country like America and you think about IT in this context, we have a lot of systems, not just in healthcare. I mean, economics, finance, governments. It's how we got rich. It's how, no matter, there's a lot of different stories in this room, and a lot of you overcame a lot of personal challenges to live the life you've had, but none of us, in the immortal words of Robert Strauss, was born in a log cabin we built ourselves. We had access to systems along life's way which allowed us to make decisions, be rewarded for them, and find our way into this great room today. So, and that's the story of every advanced society. And it is human nature, and you can see if you go all the way back 8,000 years to the Sumerian civilization, when you build these systems, first of all, you don't always get it right. Like, think about how American healthcare developed just on the financing side. Lyndon Johnson, this massive majority in Congress, even then knew that he didn't have the support to let America join every other advanced country with a system of financing that would insure everybody. So he went for Medicare and Medicaid. And ever since then, we've been sort of tacking on to it. Like when I was president, we added the Children's Health Insurance Program. And you do these things. At some point in the life of every nation, almost every major system gets long in the tooth. That is that there are huge transactional costs in continuing to do what you were doing and the way you've been doing it all along. And if you don't deal with them, you have things like the financial meltdown. Or you wind up with an unsustainable public debt, which we don't feel today because interest rates are still below inflation. But to give you an idea of why this has to be dealt with a 10-year plan, if interest rates today were what they were when I was president, which will only happen when we start having economic growth again, but I mean real growth. But if they were, annual payments on the government debt would go from $250 billion a year to $650 billion a year. Every year. They would make this fiscal cliff look like just walking down the steps. And no aspect of our life would be left untouched. This is just human nature. Nobody needs to panic. But it means that sooner or later, public citizens, including those in private health care, you can't keep defending the status quo, whatever it is. There's no problem we can't deal with, but you got to show up for work and make a deal. After a while, the speeches aren't all that important. It's what you do that matters.